Hi, my name is Haley. I'm going to be your physical therapist today. So today we're going to work on some wound management. I'm going to take off this dressing, assess your wound. I'm going to clean it and then reapply a new dressing. So I'm just doing this to make sure that your wound is healing properly and there is no infection. You should not feel any pain throughout this process. You might feel some cold and some pressure, and that's okay, but I just don't want any pain. So if there is, just let me know. Are you having any pain right now? Okay, is that in the wound or is that elsewhere on your body? Okay. On a scale of 0 to 10, with 0 being no pain at all, 10 being worst pain imaginable, how would you rate that pain right now? Okay, we'll just keep an eye on that pain. Let me know throughout this process if that gets worse. I'm gonna go ahead and clean and set up my treatment table, and then we will get started. I'm gonna go ahead and clean off my table. Clean my spray bottle with my pen. My laundry basket and my trash over. And I'm going to go ahead and wash my hands. Okay, I'm gonna go ahead and set up my area over here. So this towel is going to be my clean towel. And then this one will represent my dirty towel. Okay, I'm gonna go ahead and move my clean supplies over. Okay, I'm going to go ahead and put my PPE on. gonna go ahead and put a towel underneath you and then one on top. So I'm gonna have you roll away from me and then towards me. Okay, good. Now I'll place this one on top. Okay. I'm gonna go ahead and take off the dressing. Okay, on the secondary dressing, there is no exudate and no odor. And on the primary dressing, there is minimal serosanguinous exudate and no odor. Okay, I'm gonna go ahead and clean your wound. This may feel a little cold. I'm gonna take off these gloves, throw them away. And I'm gonna go ahead and get my tape ready. All right, I'm gonna go ahead and assess this wound. So I'll take some measurements first. Maddie, if you don't mind writing these down for me. I am going to be measuring from 12 to 6 first for the length. And I'm getting 4.7 centimeters for the width, from 10 to 4.1 centimeters. I'm gonna measure the depth. Getting 0.9 centimeters for the depth, and there is tunneling at 4 o'clock. That is 0.5 centimeters, and there's undermining from 6 o'clock to 9 o'clock. That is 0.4 centimeters. The tissue types in this wound, there's 65% granulation, red granulation tissue, 15% black dry eschar, 15% subcutaneous tissue, and then 5% slough. For the wound edges, they are unattached, and the peri-wound is unremarkable. I'm gonna go ahead and get my peri-wound protector. Apply that. I'm gonna go ahead and pack the wound. So I'll take my primary. You may feel some pressure with this. of the way, get my secondary. Go ahead and take that down. Go ahead and sign date and put the time for this. Okay. I'm gonna go ahead and remove these towels, put them in the laundry. I'll have you roll that way and towards me. So today I went ahead and took off your other dressing. I cleaned your wound, assessed it, and put on a new one. Some things that I want to talk about is just implementing a turning schedule every 2 hours just to make sure that we're keeping pressure off of this area so that it can heal properly. We also want to make sure that you are getting enough sleep and that you have proper nutrition because those things can impede your wound healing and we do not want that. How is your pain right now? Okay, on a scale of 0 to 10? Okay, we'll keep an eye on that. So I'm gonna go ahead and clean my area and then I will get out of your hair. So I would throw away any contaminated trash, but I don't have any on my clean towel. So I'll go ahead and take off my PPE. Maddie, if you will untie me.
All good.
Thank you. Put this in the laundry. Take off these gloves. Throw them away. Counter. That way. I'm going to remove my clean supplies back to my clean area on the counter. And throw these towels into the laundry. And clean off my table. Move my trash and my laundry back to their original spot. And then I'm gonna go ahead and wash my hands.